Hi, my name is Vanessa Camacho. For today's presentation, I'm going to be talking about workplace violence. I chose a bill based on workplace violence, so that is what my change project is going to be geared towards. Some objectives for today's project. I'm going to define Workplace Violence Prevention for Healthcare and Social Service Workers Act. I'm going to provide my thesis, facts on workplace violence and healthcare. I'm going to present my change project idea, and I will also identify stakeholders, provide a budget, and I will talk about how to evaluate success of the project and how we can maintain it. So, a little bit about the Act. It's the Workplace Violence Prevention for Healthcare and Social Service Workers Act. This act was sponsored by Joe Courtney, a Democratic representative for the state of Connecticut. It was introduced on February 22nd, 2021, and it was passed on April 16th. So this bill, it must issue an interim occupational safety and health standard that requires certain employees to take actions to protect workers and other personnel from workplace violence. So the purpose of this bill, it would curb rates of on-the-job assaults by writing and implementing a workplace violence prevention plan to prevent and protect employees from violent incidents. It requires the workplace to provide workplace violence prevention training and investigate violent occurrences. My thesis for today. So this project, it'll provide information about HR 1195, as well as offer information on workplace violence and healthcare, which we know is a huge problem. Workplace violence can be decreased by implementing a rapid response security team to arrive quickly during violent incidents. Educating and spreading awareness of workplace violence will provide and maintain a safe environment for healthcare workers and patients. A little bit about workplace violence. Workplace violence is related to abuse, coercion, or assault of workers. This can be physical assault as well as verbal assault, which obviously I know a lot of nurses and healthcare workers have encountered at work. It is a major healthcare problem. Workplace violence can lead to work-related illness, job dissatisfaction, and absenteeism, which is really important, especially now we know there's a staffing issue in healthcare, and so absenteeism is big. We want to do everything we can to make our healthcare workers want to stay at their institutions. Workplace violence can affect the quality and safety of patient care. Healthcare workers, especially nurses, can just feel inadequate and frustrated after dealing with workplace violence. It actually represents 25% of total violence in all workplaces, with nurses being the most involved, which is a lot. Nurses have an increased risk of suffering aggression, PTSD, burnout, depression, and anxiety after dealing with workplace violence. So on the right here, I just added two charts. I'll start on the bottom. This is from 2011 to 2018, and it just shows the incidence rate of non-fatal workplace violence to healthcare workers. And as you can tell, it's just rising. And it stops in 2018, so I'd be curious to see even up to just 2000 last year. I'm sure it's still rising. It's a major issue. And then the chart on top, it's the number of non-fatal workplace violence injuries and illnesses with days away from work, same years, 2011 to 2018. But if you look closely, the red is healthcare industry and the blue are other industries. So if you can tell, obviously, healthcare just takes up a huge chunk of non-violent of violent occurrences at work. My change project idea would be to implement a rapid response security team. So this would be just solely for, it would be like a rapid response just for security to come defuse a situation. We would page overhead during violent incidents, or if we think a violent incident will occur, so security can arrive in a timely manner. I know that where I work, that's not something that we practice. A lot of times we will just call security from our phones, and there have been times where it takes security a long time to arrive, which is not safe for nurses, healthcare workers, or patients. So I think by providing this and having them come in a timely manner, it will decrease workplace violence incidents, and it'll provide a safe environment for everyone. Also, I think in doing this, it'll boost morale. So nurses and healthcare workers will feel like understood and appreciated and safe, and it'll make them want to stay employed with their institutions. I think that's very important. The stakeholders that would be involved in this, so obviously I think you would have to get nurses together. For instance, I would get the nurses together that I work with on our unit. We would reach out to nursing organizations such as the American Organization for Nursing Leadership. They are committed to providing nurse leaders with tools to prevent workplace violence. Also, there's the American Hospital Association. They have the same thing. They have that Hospitals Against Violence initiative. So they are doing what they can to work towards decreasing workplace violence. So getting them involved and having their support is definitely important. And then we would just join together and I think present our idea to hospital administration. And we can start small. We can start with the nursing supervisors, managers, assistant nurse managers, bring it up to them, and we can arc it up to directors, like the director of nursing, and eventually bring it to the CEO of the hospital so we can have the support and start to make the changes. Those are the people that we would need to be involved. Acquiring stakeholder buy-in. I think, again, there is strength in numbers. So the more people that you have, the better, all the support. So just gathering everyone you need to gather. And we would need to present a clear plan, goals, and facts. I think the facts are so important. A lot of times, these directors, these CEOs, the higher ups, they're not, I'm sure they hear about it, but they're not there to experience it. So I think presenting them with the facts of workplace violence, how prevalent it is, how it affects us as nurses, how it affects all the staff, I think that's important for them to know. So we could always bring our stories to them, facts, and we can talk about how it would save the hospital money, because workplace violence can cost the hospital money. So if we implement this plan, maybe it'll save money for the hospital in the long run. And we can do that by communicating through emails, letters, presentations. I think that's the most important thing. You have your hospital-wide emails. You can send them to everyone. We can write letters. And like I said, we can do presentations on the unit. We can ask for CEOs to be a part of our presentation so we can present to them. So those are just some ways of being able to acquire the buy-in. For a budget plan, my thought process behind this was there's security guards throughout the hospital, but we would need a team of security guards that are just for the rapid responses. So just guessing, I guess the annual salary for a security guard in Connecticut is anywhere between $30,000 to $40,000 yearly. So if I had to guess, maybe 6 bodyguards doing 12-hour shifts to cover, that group always being there, it would cost anywhere from $180,000 to $240,000 a year to meet those salaries for the extra security guards. Also, I would have to think about, maybe getting like a group together on each unit, Nurses Against Workplace Violence group, and maybe they would put in some extra hours to put together some surveys, to put together meetings. And if they were doing that outside of work, we would have to consider like extra hourly wages for them. And I actually did find a PDF for this bill that just projected some numbers for this bill. So according to them, implementing this bill would cost $18 million from 2021 to 2026. So they just looked at it over a 5-year period. Determining effectiveness for this project, I think just maybe having someone from one of those groups, a representative from one of those groups, to put together a survey to send through email, just so we can do like monthly check-ins to make sure that it is effective and people are feeling like it's effective and they feel satisfied and they feel safe, because that's the most important. Quarterly meetings with team members, maybe just getting everyone together just to stay focused and stay on track and make sure that the plan is working and progressing, and we just keep everything, I think this can also help with just underreporting of violence. I think a lot of times violence at the workplace is not reported just because you find yourself in a situation that is violent with a patient, and then you kind of just have to move forward. But determining the effectiveness with these surveys and these meetings, it'll just keep us on top of the workplace violence that is actually happening. So we'll be informed, which I think is also important to determine effectiveness of this program, of this. Plan. Maintaining sustainability, I think it's important to form a group on each unit. Like I said before, just have like a group of Nurses Against Workplace Violence, and we can have a representative from that group, just one, attend daily huddles, and attend meetings, just to offer information and receive information and report back to the group. So that way, we can just ensure that things are being done. And then also the members from the group can ensure that surveys are being filled by following up through emails and communicating with nurse managers, just keeping that communication open. In closing, this bill, HR 1195, ensures the safety of nurses and patients and all healthcare workers throughout. Workplace violence is a major healthcare issue, and it affects quality and safety in patient care. I think it's something that we really need to look into and to try to fix as best as we can. This project will decrease incidents of workplace violence. It'll boost morale, so nurses and again other healthcare workers, providers, will feel supported and feel safe. And lastly, just working together makes for a strong institution. Again, there's strength in numbers, and I think everyone working together and collaborating and feeling seen and heard, and like we all support one another and we care about each other and the safety of our patients, will make a huge difference in the institution. And these are my references, and thank you so much.